Gonzalez. My name is Vanessa, and I'm going to be the nurse in here today, asking you some questions about your illness. So what have you come into the clinic for?
Breathing problems.
Some breathing problems, okay. What kind of treatment are you wanting to get?
Just something to help me breathe better. My asthma inhaler isn't working as well as it has been.
Okay. Are you breathing okay right now?
Mm-hmm.
You're not having no problems with that? Okay. What are the symptoms of your asthma?
Shortness of breath, tightness in the chest.
Okay. That's what you normally have? Okay. How are you managing that asthma?
My inhaler and an occasional breathing treatment.
Okay. When was the last time that you had an asthma attack?
About a month ago.
A month ago, okay. Are you allergic to any cats?
Yes.
Allergic to cats? What actually triggers your asthma?
Cats, dust, pollen,
Stuff like that? Okay. And when did your asthma start acting up?
A couple weeks ago.
A couple weeks ago? Okay. Have you had any problems since your asthma attack?
Every now and then.
Any breathing problems? Okay. Okay. What makes it worse? Just like lying down on your back make it worse?
Yeah, like at night, that usually keeps me up sometimes when people smoke.
Okay, okay. Have you had a cough or anything?
Mm-hmm.
Are you spitting anything up with the cough?
No.
No? Okay. Have you had any wheezing?
A little bit, yes.
A little bit of wheezing, okay. Are you taking any asthma medication?
Besides my inhaler.
Nothing? Okay. And how many puffs do you normally take with your inhaler?
About 2.
2 puffs? Okay. And does that work pretty well?
Mm-hmm.
Yeah? Okay. Have you had to use the inhaler in the last 2 days?
Yes.
Okay. Is there anything in your environment that might make your asthma a little bit worse?
Besides dust, not really. None of my family smokes, nor do I smoke.
Okay, okay. And your cough, when did that cough start?
About a week ago.
Okay. Does it get worse at night?
Mm-hmm.
Okay. Does your asthma keep you up at night?
Sometimes, yes.
Sometimes it does? Okay. When were you diagnosed with asthma?
When I was 2 years old.
When you were 2. Have you had to be in the hospital or anything for asthma?
Mm-hmm.
Do you have anybody in your family that has asthma?
Not in my immediate family.
Okay. You said you don't smoke? Are you around anybody that smokes?
No, ma'am.
No? Okay. Do you use like any marijuana?
Mm-mm.
No?
I don't do drugs.
You don't do drugs? Okay, awesome. That sounds very good. So what we're going to do is go ahead and we'll do an examination and listen to see what your lungs sound like, if there's any wheezing or anything. And at this time, we normally would have you disrobe the top so that we could actually see your chest to make sure that it is symmetrical and everything is equal when you're breathing in. But since we're on the video, we're not going to do that. I would go ahead and take your respiration rate and make sure that your breathing is even, normal, no problems with that. If I had a pulse ox, I would go ahead and check your pulse ox to make sure we'd see that you're getting enough oxygen. I would check your fingernails, make sure that there's no cyanosis, around the lips, you're getting enough oxygen and everything that way. And then, like I said, we would make sure that your chest, everything is equal, symmetrical with your breathing. We'd go ahead and check your trachea, make sure that it is midline. So we'll start here, and it is midline. There's nothing that is unequal. And then I'm going to go ahead and check the expansion on your chest. So go ahead and do like this, and if you can breathe in and out, there we go. And same thing here. Very, very good. Okay, and then I'm going to go ahead and have you say 99.
99.
99.
99.
Okay, and then if we can go ahead and do also in the back, if you can turn just a little bit, and same thing with that.
99. 99.
Okay, very good. Okay, I'm going to go ahead and percuss and see if there's any difference in tone. Okay, you can raise your hand up here. Okay, on the side here, and then we'll also do in the back. Okay. Okay, and then I'm going to go ahead and listen also. Take a deep breath. Up here. Make sure there's no wheezing. Very good. Let me listen to the back. Very good. Okay, well, your lungs sound very good today. So I think we've listened to all the stuff. We're going to document and everything, and we'll get back to you. And thank you very much for letting me examine you today.
Thank you.